Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Michael Reynolds here, and welcome back to Research Perch from the Massage Therapy Foundation. We're glad you're here. Again, I'm Michael Reynolds, the chair of the marketing committee for the Massage Therapy Foundation. And as you know, Research Perch is designed to take articles and studies from the IJTMB, which is the International Journal of Therapeutic Massage and Bodywork, and kind of unpack them and really dig into what it means to you as the practicing massage therapist. So, as always, here with Nikki Monk and Ruth Werner. Nikki, having a good day?
Having a great day, Michael. Thanks.
Excellent. And Ruth, how are you?
Having a great day, enjoying a little bit of rain on the beach today.
Wonderful, wonderful. Glad to hear it. Well, today's topic is massage therapy and labor outcomes, a randomized controlled trial. I love this one. I'm sure a lot of people are kind of on the edge of their seats waiting for what this study says about labor outcomes. I know a lot of people are probably very interested in this. And actually, I want to start this conversation with kind of how it opens in the abstract in the article. And it says, massage is a time-honored method by which women have received comfort throughout the millennia, yet it has not been rigorously evaluated in the modern-day delivery suite. So as we know, massage therapy, well, it says here, not necessarily studied a whole lot in how it relates to labor outcomes. And it says the purpose of the study was to evaluate the effectiveness of massage therapy provided by registered massage therapists in managing pain among women in active labor. And the study was actually done in Vancouver, British Columbia, it looks like. So, like I said, I know a lot of people are probably on the edge of their seat saying, wow, what is this going to tell me? So who would like to start us off and kind of unpack this for us? Ruth, Nikki?
I'd like to dig in just a little bit to set things up a little bit, if that's okay, Nikki.
Sure.
The first thing I want to define is registered massage therapist, because that has a specific meaning. So this is a study using people who were trained and licensed to do massage therapy in Vancouver, British Columbia, which has, among the highest education standards really on the planet. I think it's, oh gosh, I forget now if it's 2,200 or 3,000 hours, but it is a kind of training where people are going to enter into this with a good deal of technical knowledge under their belt. The second thing I want to say is that this is a study that happens in a real setting. Right, so this isn't put away in a special research branch of a massage school somewhere. This is in, if you like, the blood and guts part of childbirth, and so the way there's not a lot of freedom or a lot of space to ask a huge amount of questions or to track a lot of variables, because really it had to hone in and just focus on the one thing, which is pain. So what we're not getting out of the study is anything about labor complications or maternal attitudes or bonding, or there's a whole slew of other things that people may look for as part of the childbirth experience. And really the only thing that this study gathered data on consistently was pain. Not to suggest that that's not important, it certainly is. But it's really surprising to me how little the effectiveness of massage therapy has been documented in the research literature in this field. So.
Well, I think another interesting thing to point out, too, with this beginning piece is another one of the outcomes that they were looking at was epidural usage, right, and when the epidural was administered. Yeah. And I think that the key point, going back to what Michael was highlighting, was in the modern maternity suites. Right. And so massage, how birthing has been done has changed over and actually just kind of recently, since modern medicine, probably in the last maybe 60 years, Ruth, do you think?
Yeah,
they've started using that sort of piece. Natural childbirth used to be the thing to do, and massage therapy, I don't know the history on it, but I would imagine massage therapy was used quite a bit, and
it wasn't called that, certainly, Right. And then there were, when people of my generation were born, women were knocked out; they weren't awake. Right. Mm-hmm. For any of it. And then, of course, in the probably mid to late 60s and onward, there was a huge shift in looking for a more on-purpose experience in the labor room.
Mm-hmm. Right, right, and I'm one of those generation folks. I had two somewhat recently that was able to experience that, and so when I first looked at this study and started reading about it, I was actually somewhat surprised to see that epidural timing was one of the outcomes, and then I had to step back and go, wait a minute, this is looking at it in what is typical and modern in birthing situations, and so this being an outcome is appropriate. Now, a whole nother study could be whether or not somebody was able to avoid an epidural for those who were interested in something like that. Right, so I just wanted to point that out, that was one of the other pieces, because of course the longer you're able to keep from starting that epidural, the better the labor outcomes and the delivery outcomes
tend to be. Yeah.
Yes.
So I was looking at kind of further down the study here, and it was talking about how they actually measured pain levels, and I noticed it said the McGill pain scale. Tell me a little bit about what is the McGill pain scale. How does that work?
Well, I think the main one that they used actually was the VAS, wasn't it? Didn't they use the visual analog scale? Or maybe
maybe I missed that.
Well, no, I guess they do. They say the pain intensity scale. So the McGill piece, it's actually, my familiarity with it is that it asks you a series of questions and basically describing the pain, and it gives it a score essentially. But that is the way that they quantify it, was how bothersome or intense are these different pain experiences. So it is a very validated way to measure pain, and they were using the one that is for this moment. I'm looking to see if I can actually find the description of it. I think I'm confusing the VAS with a different study that we looked at.
Okay, so it's basically just a way of measuring, you pick a number and pain is high or low, so to speak. So
but as I recall, one of the weaknesses that they mentioned in this study was that they gathered that information afterwards.
No, they gathered it during.
Okay, thank you.
You're thinking of the other one, Ruth. I know exactly what you do. Yeah, no, they actually collected the pain intensity in this study at 3 different time points, depending on the cervical dilation. So they were looking at it when the cervix was dilated 3 to 4 centimeters. Then they asked again when the cervix was dilated 5 to 6 centimeters, and then again 7 to 8 centimeters. And so that was where they were getting that.
Mom threatened to whack them out of the room, and so that was.
Right. Stop asking me these questions. Go away. And one of the things that I'm not clarified in the moment on is whether or not those pain questions were continued after the insertion of the epidural. I don't recall that. Do you?
No, I don't. I'd be surprised if they were, though, because that's the point of the.
Right. Yeah, I would imagine so too. And so with that being said, that may have been part of the reasons that the one of the things that is notable about this study is while they report a lot of differences, none of these differences are statistically significant. And this may be one of the reasons that when you do a repeated measures analysis, when you measure the same thing at different time points, if you start losing data because either it stopped being collected or it's missing or what have you, the weaker the analysis becomes. And so while they note differences in those who were in the massage group actually had lower pain scores at all of these different points, those differences were not statistically meaningful.
Now, does the sample size have anything to do with that? I noticed it was 77 participants. Does that have anything to do with the significance statistically?
It will, yeah. It depends on it. There's several different things that are going to contribute to statistical significance. One is going to be your sample size and the amount of power that's going to entail, and also the effect size, which is basically effect size is the amount of difference or the amount of change that is occurring. Okay.
Okay.
And so with this being a pilot study, and we should note too that these folks were randomized. So let's back up a little bit and talk about the design of the study. So this was a randomized controlled trial. Randomized basically meaning that they were either given the massage group or they were given the standard care, so they didn't receive the massage. But they did a really clever thing, because one of the things in massage studies that you have to be careful of is those who are randomized to the non-massage group, or they're not getting the massage, they're going to drop out. They're not going to do the assessments, and then you don't have anybody to compare them to. But they avoided that by, it was a massage study either during labor or post-labor. So everybody got massage.
Yeah.
It was just as a matter of when they got the massage. So really clever on their part. Really good way to do that. So half of them, in fact, 37 were randomized to the massage group, and then 40 of them were randomized to the usual care group. So only 37 of them got the up to 5 hours of massage treatment. Once the epidural was put into place, they no longer did the massage, or if they reached 5 hours.
Got it. Makes sense. Let me pause for just a second. Quick sponsor shout out. We do want to recognize our sponsor today, which is Anatomy in Motion. Definitely recommend you check them out if you would like a beautiful, absolutely gorgeous app for an iOS device like an iPad or an iPhone that allows you to really analyze the muscle systems of the body. If you're a massage therapist, a body worker, anyone who works with the human body really needs this app. It's also awesome for students or really any practitioner because, again, it lets you really view 3D models and systems of the muscles of the body right there on your iOS device. I know, Ruth, you really are a big fan of the app. You use it on your iPad. So we definitely recommend checking that out. Again, it's Anatomy in Motion. They are most active and found most often on Facebook. So if you go to Facebook and search for Anatomy in Motion, definitely give them a like, and you can find their website and where to download them there. You can find them in the iTunes store as well. So again, thanks to our sponsor, Anatomy in Motion. We appreciate that. All right, so this is very cool. I love this study here, and obviously I'm thinking about massage therapists here are probably listening, saying, well, obviously, like this is what we've been telling people all along, that massage therapy can really, benefit many stages of pregnancy, including labor. But what I love about this is what we're really doing here at the Massage Therapy Foundation is backing up these hunches with science, right? That's what we're doing here, and what we're really doing is studying this stuff and gathering data. And I realize this is an early study, and Nikki, you mentioned that this is really a precursor to going a bit deeper. But what I love is the fact that the research is happening here to really support what a lot of massage therapists already believe, which is awesome. So yeah, go ahead.
If you don't mind, I really need to temper that a little bit, Michael, because when we are willing to ask questions like, does massage, actually have an impact on pain during labor? We have to be willing to live with the results, even if they're results that we're not that thrilled about.
Sure.
But we're not conducting research to validate what we've always been saying. We're conducting research to test what we've always been saying, because if we're saying something wrong, let's quit.
Right.
It may be a way to identify those who are going to get the benefits we're expecting. Mm-hmm. And so it very well may be that while they didn't necessarily look at that in this study, but it may be that those who come in with the expectation that massage is going to be beneficial for them, for instance, the massage is going to keep them from having an epidural, that's a bit of a different question. And so now you get these folks who go in with the intention of not receiving an epidural, of having natural childbirth. They have a registered massage therapist or a licensed massage therapist or whatever kind of massage therapist is available there to come with them. And then you start looking at the differences between either those who went in with the intention and received massage versus those who maybe didn't go into with the intention and received massage, and see if the epidural rates are different, see if the pain rates are different. But that's a different kind of question than that they were asking.
Right.
In the study. Mm-hmm.
Okay.
But that's what these studies do, is they open the door to asking more questions.
Right.
Right. So I definitely want to identify this as kind of a, like you said, Nikki, an early stage study. You'd like to take it further. And you're right, we do have to live with the results. If the results say, well, actually what we believe is not quite, accurate or it's not really validating it, we have to understand that and be willing to accept that. So, well, that does bring me to the conclusion. I want to hear how you interpret this, Ruth or Nikki, because it basically concludes the way I'm reading it. It says, findings from this pilot study suggest that massage therapy by a registered massage therapist has the potential to be an effective means of pain management that may be associated with the delayed use of epidural analgesia. So it's being very careful in language. So I guess it's really just kind of saying, well, it has potential, we don't know. Is that kind of what we're getting?
From this study, yes, and I think there's a couple of things too about this methodologically that those cautionary pieces are appropriate. One, of course, is that there wasn't statistical significance in any of their outcomes that they were looking at. So you can't say that while there are differences, you can't say that they are significant in that realm. But
well, I want to come back to that, but
okay.
Keep going.
But it could be that they point out, rightly so, is that the sample size may have been the issue here. That perhaps because it was not a robust sample size, the statistical significance couldn't be reached. Okay, so there's that piece. But also, this is a pragmatic study, meaning this is a study that was not set up to be explanatory in nature. While it was a randomized controlled trial in instances of that was randomized, there were many aspects of it that were controlled, specifically in regards to the inclusion criteria and the like. It was still done in usual care and in the sort of chaos that childbirth can instill. Now, granted, I don't know how exactly you would do an explanatory study that was very tightly controlled with massage therapy in a delivery type situation. That would be really, really challenging. But they do, this is how it would, if massage were available, this is how it could be
what it would really look
done.
like.
Right, and what the sort of outcomes would be.
So what I wanted to answer to that, Michael, is that there's a huge difference for our listeners. There's an important difference for us to point out between statistical significance and clinical significance.
Absolutely, clinical meaningfulness. Yeah. Mm-hmm.
Yeah. So as Nikki says, the numbers that people reported on their pain questionnaires between the people who got massage and the people who didn't get massage, there were some differences. The people who got massage reported less pain, but it wasn't a huge enough difference between the two groups for the researchers to call that statistically significant. And there's a whole sort of separate science behind that, and that makes some sense. But that said, the fact that the women who received massage, the fact is, the women who received massage experienced and reported less pain than the women who did not receive massage. And by and large, and this is another finding that we mentioned at the beginning of our talk today, the women who received massage were able to delay starting their epidural for at least for the average of an hour. No, it was 2 hours. It was 2 hours. It was like a centimeter, and it was 2 hours, or it was a significant amount of time. And for those of us who have been through the process or watched our friends go through the process, introducing an epidural can really make a big difference in the experience of the mom and being able to be in control and have a successful and wonderful labor. But it also comes with a bunch of possible complications. People can be allergic to the stuff. The baby can have a bad reaction to it. There's just there's a whole slew of extra things that can go wrong. And so the longer that can be delayed, the better the probable outcomes for both mother and baby. And if massage can delay that, that is clinically significant.
Interesting. So I'm seeing a theme here in our discussions, the more of these we do, and I think you'll agree that the theme I'm seeing is that a lot of the things we're studying here kind of point to cautious optimism, and what's needed here is more research. Would you agree?
That will always be the case.
Yes.
More research, absolutely, and hey, that's what we're all about here at the Massage Therapy Foundation. So can't help but make that note there. So is there anything else that either of you read from this study that we haven't discussed yet?
The only other piece that I would have liked to have seen in the study is the reporting of the therapist descriptors and the therapist characteristics. So Ruth did a really nice job of differentiating what a registered massage therapist is and what that means in the environment in which these folks were in British Columbia. But it would have been nice to know how many therapists were a part of their regime. They do note that they had limited therapists in that they couldn't have a therapist come in and relieve somebody, so that's why they had 5 hours as the max amount of time. But knowing a little bit more about the therapists would have been nice. How many were utilized, what their educational background was, how many years experience they had, those sorts of things, and maybe even a description of some of the techniques that they used.
Well, I can add a little bit to that as well, which is another variable that I'm sure a lot of our listeners would be curious about, is if those massage therapists had any kind of relationship with the family going into labor, because a lot of pregnant women who want a doula or a massage therapist in labor have already established a level of trust and a level of comfort, and that may also impact their pain scores.
Well, my understanding of the study was that there wasn't any relationship with these folks. Now, some of them did have a doula with them, and they actually note that, but that none of the doulas that actually came through were qualified as a registered massage therapist.
Right.
So, and that may be a regional difference, because I know a lot of doulas, at least where I practiced before in Lexington, Kentucky, a lot of the doulas were massage therapists.
Right.
As well.
Right. So we've got some cultural things there, and and all of those things again may have impacted why the statistical significance was so low.
Right.
Because I would predict. Oh, pardon me. That's my dog. I would predict that the significance would be higher if these other sort of dominoes were stacked up to create the best possible kinds of outcomes.
Well, see, even Ruth Dog supports research.
Yeah.
Piggybacking on that, Ruth, what an interesting study might be would be to have, now you have the usual care group versus those who get assigned a massage therapist versus those who come in with a massage therapist in tow. I mean, and those are the folks that you could actually pre-identify with, hey, would you be a part of the study when you go into labor and your massage therapist is one of the therapists? That would, hey, who did this study? Hey, Jensen. Ideas for the next study. That would be great.
Well, I do want
to... Before we wrap up, Michael, can I just ask, is that an appropriate thing to do, to say, wow, I read your study and it makes me really excited to learn more. Would you think about doing a follow-up that might ask that question? Is that the kind of letter that researchers sometimes get?
I have never gotten that letter. Of course, I haven't done a lot of pieces out to be extended on yet that's published, but I think that might be an appropriate inquiry. But I think that how involved somebody might want to be would certainly be a factor in that. But one of the things that can happen is, it very well may be that, and this isn't to say that these folks that this is the case for, but it very well may be that somebody isn't in a position to do a whole lot of research or even to do the next step of it. It may have been that they had a small award, they're more on a clinical track, or they're not in a research type setting, and so somebody else may take this design, pick it up and do a different study somewhere else and use this as the foundation. Now, what might be really interesting is, hey, I really liked your methodology and approach. Would you mind sharing some of these pieces with me so they're not having to reinvent the wheel? So I know that I've certainly done that with other researchers. Hey, you had this way that you were collecting data. Would you mind sharing that? And of course, then anytime I publish on it, I give credit to them and say, hey, appreciate these pieces and the acknowledgments. But yeah, I think that if this was something somebody was interested in, either doing on their own or maybe being involved in the next steps, a letter would be appropriate. They have contact authors on these pieces and contact information to the corresponding author that would be appropriate to contact.
Thank you.
I would love our readers, our listeners, to know that it's not that rare for people who are interested in research to reach out to the authors that are doing the work that make them really excited. And you may not get a response, but it's something you could think about doing. If something you hear about or read about really lights a fire, I really support people reaching out and contacting the researchers, because everybody likes to know that their work is appreciated.
Absolutely. And
Yeah, go ahead. I'm sorry, Nikki.
And many folks are actually willing to meet you. I mean, if you're going to be at a conference and you know somebody else is going to be at that conference or a convention, sending a quick email, hey, I'm really interested in your work. I'd like to talk with you about it, or what have you. Would you have time to meet with me? A lot of people are really nice.
And Ruth, would your ebook on our website be a good next step for people to learn how to do that?
Yeah, oh, absolutely. There's a little section on that in this, on the scenario that Nikki just described, actually, which is, meeting people you're interested in at conferences. So as Michael just referred to, at the Massage Therapy Foundation, we have these free downloadable ebooks. It's under our resources tab, and this book is called How to Connect with a Researcher, and it's something I put together along with several researchers and massage therapists who have walked that path of getting excited about a project and then finding a way to get involved in research on a larger scale. And so if you're interested in that, that book is waiting for you.
Awesome. Thank you, Ruth.
Yeah.
All right. Well, I really enjoyed this one. I'd love to see further research. So hopefully we'll be able to circle back at a future date and learn more. So Nikki, thank you so much. Ruth, thank you for your insight as well. Really appreciate the discussion today. So thanks so much for joining us today for Research Perch. Again, we're at massagetherapyfoundation.org if you're listening, and if you're watching, please look below to see other methods of subscribing and taking this podcast with you on the go, as well as links to the articles, which are at ijtmb.org. And we definitely encourage you to subscribe to ijtmb.org as well. It is free. Along with the ebooks we mentioned, they're also free. We make those available to you anytime. So thank you so much, Nikki. Thank you, Ruth. Real pleasure talking with you today. Appreciate it. And thanks, everyone, for joining us. Have a great day.
Bye now.
Bye, Mike.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.